For millions of women, the words, "you need a hysterectomy," can feel like a devastating diagnosis. It often means accepting the reality of a major surgery, a long and painful recovery, and the profound loss associated with it, all just to find relief from debilitating symptoms of uterine fibroids. You've been told that this is your only option, but what if it wasn't? I'm Dr. Kevin Barton, CEO and Managing Partner of ARV Centers, a leading interventional radiology practice in San Antonio, Texas. Our entire mission is built on the core principle of interventional radiology itself, that we can achieve the same or sometimes even better outcomes as traditional surgery, but with procedures that are far less invasive, have fewer risks, and offer dramatically faster recoveries. Today, we are pulling back the curtain to show you how an in-office procedure could help you finally get rid of your fibroids and all of those unnecessary symptoms. You are about to witness a groundbreaking procedure called Uterine Fibroid Embolization. This is also known as UFE. This isn't exactly new. UFE has been FDA approved for over 25 years in the United States, but if you've never heard of it, you're not alone. And there's one simple reason why. This advanced procedure can only be performed by a specially trained vascular and interventional radiologist like Dr. Joseph, and you'll meet him in just a second. This is not an OBGYN procedure. This is not something that they are even trained to perform. What you're about to see is not a simulation, it's an actual procedure performed right here in our center. You will see how we use advanced image-guided technology to treat fibroids through an incision smaller than a grain of rice. And you'll see it performed by a true master, one of our interventional radiologists, Dr. Arthur Joseph. He's a board-certified vascular and interventional radiologist, and he's dedicated his entire career to mastering this precise image-guided technique, helping countless women avoid major surgery. What you're about to see is a uterine-sparing procedure with over a 90% success rate treating uterine fibroids. So what do you say? Are you ready to see it? All right, let's go inside.
We're doing a uterine fibroid embolization. Are you allergic to anything, darling?
No.
No drug allergies. And we're not on any blood thinners?
No.
No blood thinners. All done by Dr. Joseph. Y'all agree?
First thing we're going to do is we're going to find the common femoral artery here under ultrasound, and then administer a little bit of lidocaine. Okay, Miss Paloma, here you go. Little numbing medicine. 1, 2, 3. Ouch. Sorry. So we're going to watch our needle going in under ultrasound there. You can see the movement on ultrasound where the lidocaine is being administered. Burns. Should be the worst part there. Little numbing medicine right here at the skin. Okay, so now we have access to the artery here. So now we're going to make a small incision here. About 1 centimeter in size. Try to open this incision up just to here. We're going to use X-ray to help guide the catheter into the aorta here. Alright, so now we're down the external iliac artery, into the superficial femoral artery, and now we can change catheters for our Robert's uterine catheter here. Bend in the catheter right at that arch. So now we push up the catheter and it should form there nicely. So now we're going to use this catheter to select the internal iliac artery, which is right there. We're trying to get our tiny catheter into the one that goes to the uterus, which is this one here. So now we have our main catheter in the internal iliac artery, and we're going to try to see if we can catheterize that vessel. So you can see a lot of blush there. So you're seeing a lot of contrast kind of accumulating in this region where we expect the uterus to be. So that would be uterine artery there. This one's going down here. We need to make sure we avoid that one because that's when it's not going to where we want here. So we're going to try to catheterize this big branch right there, going to this.
Quite a bit of blush, huh?
Yeah, good amount of blush. Given her uterus size, though, I think her other artery is probably the dominant
Right.
one. Yeah. So usually it won't have very many beads in it.
Right.
So you're going to add some contrast and some saline to get these beads to kind of float somewhere in the middle. We add the contrast so we can see exactly where the embolic is going when we're delivering it.
For sure.
So the beads are basically tiny particles, about 500 to 700 microns in size, that are going to go deposit into the end arterial vasculature of the uterine artery, which will cause devascularization or decreased arterial blood flow to the fibroids, and then hopefully shrink them. So you can see actually here is the bladder, right? And you can see how big her uterus is. It's causing compression down here of the bladder.
Oh yeah, big time.
Right, so that might be responsible for some of her bulk symptoms if she's having increased urinary frequency and that sort of stuff.
Yep.
So we can see the beads going in because they're mixed with contrast under live x-ray. So they're going exactly in the distribution that we want it to go. We're going to be giving it until there's no more forward flow here, or very minimal forward flow. And we're always paying attention back here to make sure none of these beads are coming back and could be going to somewhere that we don't want it to go to.
So you're basically just injecting as many as it takes.
Exactly.
Slow or pretty much almost stop the blood flow going to the fibroid.
Yep. So you can see there it's still kind of forward flowing there. So we're going to inject some more until it kind of slows down and stops. So now we're going to do another angiogram afterwards to make sure that it looks pretty good. So you can see now how much less shading, less vascularity to the fibroids that you saw previously over here.
Yep.
Okay.
And that lets you know that you've stopped the blood flow to the fibroids.
Right. We usually do a little bit of lidocaine inside the artery to help with the pain associated with the embolization. People don't like doing lidocaine before you embolize because it can cause a little bit of spasm of the vessel and then you get an incomplete treatment. So it's always good to give lidocaine after you embolize. So it looks good. All right, so we're gonna go try to get the other side now. This one is a lot more dominant on this side, so you can see how big and hypertrophied this side is compared to the other side.
So yeah, just the vessel's a lot larger because it's supplying more of the fibroids.
More of the fibroid, yeah.
So the body's creating an extra larger blood vessel to feed the fibroids.
Absolutely. We're going to be watching the x-ray and seeing if we can get this wire and catheter to go into that branch. Alright, so now we have our wire into the uterine artery, following it with our catheter here. Okay. Alright, we'll go ahead and get the embolization.
Well, you're almost done. Pretty quick.
Yep. Usually, in most situations, it ends up being probably a 30-minute to an hour procedure. So the bead selection has something to do with it. The beads that we're using are pretty large. They're 500 to 700 microns, and then sometimes we go up larger, 700 to 900 microns. And if you don't go super small beads, the rates of uterine necrosis are pretty low.
So basically the fibroids have real large blood vessels and the rest of the uterus has smaller vessels. So the size of the particles are only fitting in the big vessels going to the fibroids.
Right.
Pretty much.
Yeah.
What other kind of fun facts can you share about UFE?
Well, the success rate in UFE for bleeding fibroids is somewhere in the neighborhood of 92%. So very successful. Rates of complications are pretty low. Infection risk is very rare, but can happen. Most of the time patients don't feel much during the procedure. They're sedated, so they're kind of sleepy and relaxed. We're monitoring the vitals at all times to make sure their blood pressure and heart rate are okay and they're able to breathe on their own. Past that, we do give lidocaine at the skin, which tends to be the worst part. It feels like a little bit of burning for maybe 10 seconds. After that, just kind of some dull pressure, but no sharp pain. So it's starting to slow down here. We might need one more. So it is what we were expecting with this side being so big that it was going to take up, I was going to take up more beads than on the other side. So that's exactly what we're seeing here. I look at.
Oh yeah, man, what's that?
Look at that. That's a monster. Post-procedure patients, typically develop cramping. I've heard it described most commonly as kind of like intense menstrual cramping. We usually do a couple of medications to help with that. We do Toradol, which is anti-inflammatory to help with that, and then we always prescribe some strong pain medicines to go home with to help out with the post-embolization pain.
And how long does that normally last?
Most of the time, 3 to 5 days.
But I guess the first day,
first
the
day
worst.
is probably the worst. First and
Yeah.
second day, yeah. Low-grade fevers are also common in that first 3 to 5 day period. As long as the fever is like less than 101, probably
Yeah, nothing to be
nothing to
too
be
concerned
too
about.
concerned about. I would
But-
say a fever that happens after probably a week after the procedure would be more concerning for like an infection.
So I'd say most women, as we're kind of coaching them through the recovery, are able to get off the narcotic pain medication after 24 hours. If their pain's relatively well controlled with
Try to get them
the
off of it.
Tylenol and naproxen, then we'll just keep them on that. And if they need to take the pain meds, by all means, but for a lot of women, they can
Get off of it.
manage
really.
it, then yeah, they'll feel better a little bit faster. To me, I think the worst thing about narcotics is the constipation. It's just brutal.
Yeah, no, for sure.
Yeah,
Earlier you can get off of them, the better.
yeah.
Yeah, so I always tell people, try to ambulate as much as you can, but no heavy lifting, no going to the gym, nothing like that. For probably, at least 3 days. Usually tell them to take, up to 5 days probably, just to take it easy. Normal activity, but no strenuous activity.
But stark contrast to hysterectomy, right?
Oh yeah, very much so. No hospitalization post procedure. You pretty much you're walking an hour after the procedure's done.
And obviously the long period of not being able to lift anything
Yeah.
post hysterectomy is a long time,
Right.
maybe up to a month to 6 weeks.
Yeah, that's what I've seen.
Are you gonna need another physical?
No,
Okay.
I don't think so. All right,
How's it look?
looks good.
And what are you seeing?
So much slower flow. Don't see all the terminal arterioles anymore going to the uterus. Seeing some reflux of contrast along our catheter, which means that we're a pretty good stopping point here.
Awesome. It's all done?
Yeah, we're gonna give some lidocaine here through the artery, and then
It looks like start to almost finished. We're just under an hour.
most of it's probably embo time.
Yeah. So what do you think, typical blood loss during a procedure?
So maybe about a half of one of these, so something like that. That much.
So tiny amount.
You need lidocaine with a needle on it or no needle?
Yeah, I need a needle, please.
Yes, sir.
All right, you're gonna feel some numbing medicine here, okay? You might be still numb from before.
It's a nice gentle touch, I've never seen anybody do that.
Lidocaine before we close.
Yeah, just makes it more comfortable.
Yeah, lidocaine lasts like somewhere between 2 and 3 hours, so makes them a little comfortable post. Okay, so I'm gonna put this device in here, and we're getting blood back, so we know we're in the artery here. We're gonna clip it on and take this off. We're gonna turn it. That releases a foot plate,
Where you do this, this is the part I'm talking about, okay?
and so we don't have any more blood flow. That means we're outside of the artery.
That's why you numb another bit more, it still doesn't change.
Kind of make sure that it's secure here, and that's it.
That's it.
What does that do?
All packaged up,
So that
okay?
that leaves a little foot plate there,
Fantastic.
so it doesn't bleed out of the access site. So we're gonna take a picture here, and you can see on the picture here the celt deployed right there, right at our access site here. So it's gonna hold some pressure for maybe 30 seconds, and that should be it.
And that's the whole case.
Yep.
Start to finish.
Did you guys put 100 or 150 on?
So no more bleeding. So we're just gonna go ahead and put a bandage on there.
Okay, so this bowl's empty
So
over
that's an extremely small, about 2 to 3 millimeters
so
in size.
28.
That's it.
All right, what you just witnessed is the power of precision, innovation, and a deep commitment to putting patients first. You saw how Dr. Joseph was able to treat uterine fibroids simply by blocking the blood flow through an incision smaller than a grain of rice and without removing the uterus. That is the promise of interventional radiology. Exceptional patient outcomes with procedures that are less invasive, have fewer risks, and have faster recoveries. For years, women have been presented with a false choice: live with the debilitating symptoms of uterine fibroids or undergo a major surgery like hysterectomy or myomectomy. Uterine fibroid embolization changes everything. It means minimal downtime, no hospital stay, and a return to the life you love even faster. If you're one of the millions of women who have been told that surgery is your only option for treating fibroids, I'm speaking directly to you now. Your journey does not have to end there. You deserve to know all of your choices. Take the first step, click the link below to visit our website. There you can learn more about UFE, schedule a simple confidential consultation. We offer both virtual and in-office consultations. It's just a conversation to see if this breakthrough procedure is right for you. It's time to move beyond the old way of thinking and reclaim your health, and we're here to help you do it. Thanks for watching, and don't forget to subscribe. We'll see you in the next video.